Assalamu alaikum. Assalamu alaikum. Welcome to the. I'm Fawad Ali, Assistant Professor in Department of Pharmacy, Port University of Science and Technology. Welcome to the course Pharmacology and Therapeutic 2B, course code 517. We will discuss about the remaining part of the anti-amoebic drugs. The second part of. In last lecture, we discussed about the metronidazole, nitramidazole derivative, and metronidazole, its mechanism of action, adverse effect, unwanted effect, therapeutic uses, and drug interaction. In this part, we discuss about the chloroquine, like its chemistry, kinetics, antiamoebic action, epic alkaloids, emetine dihydroemetine. So in today's lecture, we discuss about the erythromycin. We'll discuss about the erythromycin, mode of action, clinical use, and adverse effects. So, sorry about the chloroquine, mode of action, clinical and unwanted effect. So chloroquine, high concentration, they have high concentration in the liver, used for in hepatic amoebiasis. It is also highly effective when combined with emetine and dihydroemetine. Chloroquine is high concentration in liver, useful in the hepatic amoebiasis. It's high effective when combined with emetine and dihydroemetine. Chemistry, like they are synthetic 4-aminophenylines. Kinetic, they are normally absorbed in different salt like sulfate and phosphate salt. They are present in sulfate and phosphate form. Like for the parental, they are like the acidic, like chloroquine HCl is normally preferred for the parental preparation. Completely absorbed after the oral administration. Protein binding. The protein binding is 50 to 65%. Peak plasma concentration is 3R, and rapid distribution and concentration in the liver, lung, spleen, leukocytes, melanin containing tissues, melanin containing tissue, retina, and skeletal muscle. So volume of distribution of the chloroquine is 13,000 liter per kg. They can cross placenta, metabolize in liver, excreted in kidney, and 70% are excreted unchanged from the kidney. 25% metabolites are excreted in 25% are excreted in metabolite form. The urine excretion increased by acidification of the urine. So parental smaller doses or slow IV administration to avoid serious life-threatening toxicity. And amoebic action. Amoebicidal action in hepatic amoebiasis. Chronic, they use chronic in liver, severe, several hundred times of the plasma. Much less effect in the chronic disease because of the completely absorbed from the small gut, much lower concentration in the gut wall. Anti-amoebiasis, amoebic drugs like alternate drug for the treatment prophylaxis of hepatic diseases, or only when the metronidazole is not effective or contraindicated. We're giving along the luminal amoebicide. More effect when given with ammetine and dihydroammetine. Epic alkaloids like ammetine, dihydroammetine, source. Ammetine derived from epic or synthetic. They're derived or synthetic. Ammetine. Dihydroammetine, they are basically synthetic. Oral administration. They are absorbed orally. The causes may induces vomiting. Low efficacy, so administer subcutaneously or deep IM. Cumulatively concentrated in the liver, lung, spleen, kidneys. They are excreted in the urine. Traces in the urine after 1 to 2 months of termination of the therapy. So, the mechanism of direct lethal effect on the tropocyte in tissues but not in the lumen. They affect virtually all type of the body, all tissues of the body. Block protein synthesis in eukaryotic by inhibiting movement of ribosomes along the messenger RNA. Also inhibit the DNA synthesis secondarily. So mode of action is like they affect virtually all tissues of the body, block the protein synthesis in eukaryotic by inhibiting the movement of the ribosomes along the messenger RNA. It's a necessity for the protein synthesis. It also inhibits the DNA synthesis secondary. Cellular damage like kidney, liver, skeletal muscle, cardiac muscle, myocardium. Cloudy swelling, necrosis of muscular muscle fibers, cardiac contraction and conduction. Myocardium cloud swelling, necrosis of muscular muscle fibers, decrease cardiac contraction and conduction. It decreases the cardiac conduction. Cardiac arrhythmias and cardiac dilatation. The action on the autonomic system, like adrenal receptors and cholinergic blocking effect, they both have parasympathetic and sympathetic blocking effect. Uses is very restricted use because of its severe toxicity. Severe amoebic dysentery for 3 to 5 days for rapid relief of the symptom. Like there's severe amoebic dysentery for 3 to 5 days for rapid relief of the symptom. Extra intestinal infection like amoeba, edema, hepatitis, abscess, they are effective in the disease. Also effective in bolentidiasis, paragomynous Westromoni infection, Fascicular hepatica infection. Adverse effect. Like they are few or mild after use for 3 to 5 days. Most serious after prolonged use. They are few or mild after 3 to 5 days. The If the use is prolonged, then the adverse effect may be more or serious. Local effect, like they are used in the pain, adverse effect, they cause pain, tenderness, and muscle weakness. Like the pain, cause tenderness, and muscle weakness, and sterile abscess at the injection site. In GIT, nausea, vomiting, usually central, like they call central, like they activate this the central like CTZ chemotech, like chemotech trigger zone, causing the nausea, vomiting, causing also causes diarrhea, usually after the several days. So these are the like adverse effect, local, GIT. Let's see CVS adverse effect. At CVS, there is the myocardial damage with the cloudy and swelling and microsis and necrosis, like myocardial damage with the swelling, cloudy, and necrosis. So there is tachycardia, arrhythmia, precardial chest pain. Patient with dyspnea or hypertension, like causes congestive cardia with dyspnea or hypertension. ECG also changes. Neuromuscular. So generally muscle weakness, myositis, tender stiffness, itching, and tremors. So those are like on the CVS, there are different adverse effects like tachycardia, arrhythmia, preclinical cloud swelling, congestive cardiac failure with dyspnea appearance, the changes in the ECG, general muscular weakness, myositis. At CNS causes paresthesia, numbness, headache, dizziness, fatigue, polyneuritis. At skin causes urticaria, eczema, or purpuric lesions. It was like at skin they cause urticaria, eczema, or purpuric lesions. In kidneys, the cause is proteinuria. At blood, they causes the decrease potassium and increase transaminase reaction. Contraindication, they are contraindicated in the cardiac disease, pregnancy, young children, renal insufficiency, polyneuritis, precautionary measure, hospitalization, and careful supervision. Strict bed rest, regular monitoring of the blood pressure, pulse, and other cardiac junction, including ECG, regular GIT, and neuromuscular examination. These are the some precautionary measures by using this drug. Like if the problem are severe, then hospitalization or careful supervision is needed. If the and strict bed rest is like will be prescribed in this case. Also, the regular monitoring of the blood pressure, pulse rate and other cardiac function, including ECG, which are altered or changes with the use of this drug. So also we have the GAT like problem like the activation of central activation of the vomiting center causes diarrhea with the prolonged use and it also causes neuromuscular junction like weakness. So both regular checkup of the GAT like to avoid any further to reduce the risk of nausea, vomiting, and the diarrhea and muscle weakness. We should have to be regularly examine the GIT and the neuromuscular activities. Second, this is a dioxanide furet. The chemistry is yeast hydrolyzed to dioxanate and furic acid. This is an ester hydrolyzed to dioxanide and furic acid. So they are no have not have specific or not known mechanism of action, but they directly may be cited in concentration 0.01 to 1 gram per ml. So broken down in GERDs, 90% dioxanide absorbed. They are broken down in the GERD, and 90% of the dioxanide are absorbed. So under reverse glucuronidation excreted in the urine. So an unabsorbed dioxanide is active clinically. So broken down in the gut, 90% dioxanide absorbed, undergoes glucuronidation, excreted in the urine. Unabsorbed dioxanide is active clinically. The phase 2 biotransformation metabolism reaction excreted into by the conjugation like the excreted in urine form. Unabsorbed vinyl oxide is active. Unabsorbed is clinically. Absorbed, unabsorbed is active clinically. So the use is asymptomatic carrier state, mild intestinal amoebiasis, other all form of disease, whether the drugs to eradicate the intestinal infection and assist. It is also effective in asymptomatic carrier state, like mild. They are mild intestinal amoebiasis, another form of the disease which whether the drugs to eradicate the intestinal infection and cyst. So adverse effect of the diloxanide furet is nausea, vomiting, abdominal cramp, flatulence, dry mouth, esophagitis, pruritus, urticaria, vague tingling sensation, and proteinuria. These are some adverse effects. Dry mouth, esophagitis, nausea, vomiting, abdominal cramp, pruritus, urticaria, proteinuria. You increase amount of proteins in the urine. The contraindication, they are teratogenic, so contraindicated in the pregnancy or children under the 2 years. Halogenated X8 hydroxyquinolines like idoquinoline, they also have like no specific mechanism, but they're effective against organism human, but not in the gut, wall, or other site. Clinical uses, they alternate to daloxanide in asymptomatic carrier state, mild to moderate intestinal infection, eradication of intestinal source, another form of the disease, like dientamoeba fragilis infection, also effective in the Giardia lambia. Adverse effect serious neurotoxic with peripheral neuropathy, subacute myelooptic neuropathy, like optic atrophy, visual loss, clavipinol after high dose more than 2 grams per day for prolonged use causes optic atrophy. Mild, they are vomiting, gastritis, abdominal discomfort, mild enlargement of thyroid, discoloration of nails and hair loss, agranulocytosis, iodine sensitivity reaction. Some references.